Good afternoon, everyone. We're gonna give it a couple of minutes so everyone can log in. We have the attendees logging in right now. We're gonna give it another minute because we have attendees logging in, and then we're gonna start. So good morning. I think we're going to start as people are logging in. So I'm Anthony Forgione. I'm the Director of Business Development for the HIA-LI. I want to welcome everyone to our educational webinar series that we're having, utilizing our members' expertise to bring you solutions and other educational things that our members are really focused on. This being a very high one that we're going to be speaking about today. Before we get started, let me just let you know about a couple of things that will be coming up for the HIA. We have our tradable sectors coming up in September. We also have our Long Island Innovation Park update coming up in September. Both of them have excellent panels. As you know, the tradable sectors are industries that bring revenue outside of Long Island into Long Island, which is a very valuable sector that for the economic growth of Long Island. And the park update, as you know, this is the second largest in the nation, and we're going to give you an update on what's going on with the park, how you can do business here, and what exciting things we have in store over the next year, even coming through COVID. And then the other two coming back, we have our Small Business Forum, which is always very exciting. We have our September 29th Business Achievement Awards, and all these events will be virtual. The Business Achievement Awards obviously is recognizing businesses on Long Island who really stand out. We have some special ones. I urge you all to register and take part of this. And actually, we're very excited because we have Kathy Hochul, who is the assistant. This is the Attorney General of New York. She'll be giving opening marks. And the last one is October 7th, October 8th. We're really excited about this. We have our virtual trade show. I actually gave a demo this morning on it. It looks very exciting. It's 2 full packed days of breakout sessions and networking on each day. And actually, one of the mornings we have an New York Yankee coach who's on the championship team, who's going to give a motivational speech on how to keep fit both mentally and physically during COVID and coming out of COVID. So we're excited about that. Again, it is free to register. And now with that said, let me introduce Jeff Weiner. Jeff is the CEO of HKM Associates. Jeff has been in the business for 39 years. HKM, it's very interesting where the name came from. The name came from his wife, Aline, and his daughters, Kelsey and Megan, which means it's very special to him when he tells people what HKM is. So Jeff, the other thing I'll mention about Jeff is very, very involved in fundraising and charities, whether it's cancer, leukemia, lymphoma. He really takes that to heart, and he's a big proponent on helping these organizations. So without further ado, we're very interested to listen to Jeff and hear how he is going to save us money going forward on our healthcare. Jeff?
Thank you very much. I appreciate it. And as Anthony said, I am the CEO of HKM Associates. And what we do is MRIs and CAT scans on insurance policies. And people are like, well, what does that mean? So we show people what they don't know, we spend a lot of our time on education, and people say, well, what is MRIs and CAT scan? Well, everybody knows what an MRI or CAT scan is. You have a problem, you're going to a doctor, and you want to find out and diagnose the problem. That's what we do, but on insurance policies, specifically on health insurance policies. So Andy, why don't you get the presentation started, and we'll go from there. So, before we get really started and getting into the details of the numbers, I wanted to explain some of the terminologies you've heard, some of the ABCs of health insurance, sort of. And this way you get a good idea of, some of the common terms you've heard. So the first one is what's called an EPO. So an EPO kind of took over from the years of where plans were HMOs, where you needed referrals and you had to go see your primary care doctor to go see a specialist and that. EPOs came out about 13 or 14 years ago. And essentially an EPO is an in-network only plan, but you do not typically need referrals. So you can go see a primary care doctor, but you can also just go see your specialist and without a referral on that type of plan. Next slide. The other plan that was very popular years ago was called a PPO. Now a PPO is both in-network with your primary care doctors, but also out-of-network coverage. So you could go to that doctor. It doesn't matter if he took insurance or he didn't take insurance, but you wanted to see the top heart guy or the top cancer guy, and they didn't participate in insurance. And so a lot of people back in the 80s and 90s had these PPO plans, and they had very low copays and very low deductibles, and the costs weren't crazy. But what's happened over the last few years is the PPOs have kind of lost favor with people because of the fact that a lot of the carriers, when you went to an out-of-network doctor, did something and they changed the payment to the out-of-network doctors, and they went to something called 140% of Medicare. So what that means is when you go to a doctor that does not take insurance, if he charged $1,000, for example, back in the days in the 80s and 90s, they paid 80% of what's called reasonable and customary. Well, now they pay this 140% of Medicare, meaning if your doctor charges $1,000 and Medicare says it's $100, they'll pay 140% of that number. So that's why it started kind of losing favor, because people were going to out-of-network doctors thinking that, oh, okay, I'm going to at least get reimbursed something rather than nothing. And now they're finding out that they're really not getting reimbursed anything. So that's why you don't see a lot of PPO plans around anymore, because of that factor. Next. With the advent of high deductible plans the last couple of years, the health savings accounts came around. Now, what a health savings account is an account where you can put away money on a pre-tax basis, meaning it comes out of your paycheck, and it works in conjunction very well with these high deductible health insurance plans. And so the health savings account money goes in pre-tax over the course of the year. And the other advantage of the health savings account is that it's not a use it or lose it type of thing. So if you put money into a health savings account, you are allowed to roll it over. So if you don't use it, plus at the end of the year, you can use it for other things other than medical. So at the end of the year, you have money left in your health savings account. You can use it for dental. You can use it for vision. There's about 50 or 60 things. If you Google health savings accounts, it'll give you a list of about, of all the things that are available with a health savings account. You are allowed to, as of this year, put in up to $7,700 as a family into a health savings account on a pre-tax basis. And again, the key is that the money can roll over, so it's not a use it or a lose it. Next slide. The next thing that we wanted to talk about was called a health reimbursement arrangement. Now, what the difference between a health savings account and a health reimbursement arrangement is pretty important, especially if you're an employer. Because with a health savings account and with a high deductible plan, companies fund the deductible, and they used to fund it with this health savings account, and it was a nice perk for the employees, but it didn't really help the companies. Well, what the health reimbursement does is it's set up the same way as a health savings account, where companies fund part of the deductible for the employees. But with a health reimbursement arrangement, the company holds on to the money. And the key is they fund the same amount of money on their claims, but they only fund it when and if there are claims. So no claims, no funding. And what's happened now, especially with coronavirus, is that there are very few claims. So companies are saving a lot of money in the premium and paying out very little in claims. Because what happened when coronavirus hit, the Department of Financial Services wanted the insurance company to forego all the premiums. The insurance companies kind of came back and said, look, we'll cover all the coronavirus claims. So if clients have coronavirus claims, they're all being absorbed by the insurance company, not by the owner, not by the employee, things like that. And with the health reimbursement arrangement, companies are paying for claims, but there aren't that many claims because people aren't going to doctors, they're not going to hospitals, they're not going to the pharmacy as often as they were. So claims are down dramatically. And with the health reimbursement arrangement, the company gets the benefit to save all of that money. So it ends up being a tremendous savings for the company with very little risk. Next slide. Now, in conjunction with the health reimbursement arrangement is something called the flexible spending account. Now, you've heard flexible spending account, HSA, HRA. You are allowed to combine some of them, but not all of them. You cannot have a flexible spending account and a health savings account and use them both for medical, which is, again, the other reason why a health reimbursement arrangement makes more sense, because you don't get the pushback on the health savings, on the flexible spending account, sorry. So a flexible spending account allows employees to put in their own money on a pre-tax basis. And prior to 2 years ago, any money that went into a flexible spending account, if you didn't use it at the end of the year, you lost the money. So people were like, oh, I'm not putting money into that because I could lose that money if I don't use it. Well, now with the flexible spending accounts, you are allowed to roll over $500 every year. So it's pre-tax dollars and it's rolling over $500 each year. So it gives you the benefit of knowing that, again, the same thing at the end of the year. If you have money left in your flexible spending account, you can use it for prescriptions and things like that. But you can also use it for pharmacy, and you can use it for medical related items like glasses and vision and things like that. Somebody asked the question, are you allowed to use an HSA throughout the year on dental? Yes, you can use your health savings account. You can use it throughout the year, but keep in mind, if you use the money for a medical related item and now you have a medical issue, you're not going to have the money in your health savings account to pay for that item, if it's medical, because that doesn't count towards your deductible. It doesn't count towards any of your claims if you use it to get dental work done. So yes, the answer is you can use your health savings money for dental anytime you want, but you will not then have it for medical. So you got to just be careful, which is why we tell most of our clients that if you're going to use that money, whether it's the flexible spending account, the health savings account, you want to try to use it at the end of the year, because most of the plans on the high deductible plans are what's called contract rate. So instead of it being calendar year, it's a contract year. So this is September. So if we started a plan in September, it would run till August 31st of next year. So it's no longer the days of, well, it's January to December. With high deductible plans, we typically, unless it's January, set it up with a contract year deductible. So this way you don't have to start all over again with your deductible and things like that. So the flexible spending account is again, pre-tax. You are allowed to roll it over. Next slide. So some people have heard of PEO, some people haven't. ADP Total Source is the most well-known name of that. So what a PEO was set up to do was kind of make it easier for groups, especially some of the smaller groups. I mean, to be able to kind of have like one-stop shopping. A PEO is when you essentially become a leased employee of the organization. So if you're an employee and you're covered by, let's say, ADP Total Source, your check's going to come from ADP. Everything's done through ADP, whether it's payroll, workers' comp, benefits, 401k, everything's done through a PEO. And when they first came out about 7 or 8 years ago, especially what was called the small group marketplace, which is 2 to 100 employees in New York, they were 25, 30, 35% less expensive than the traditional, what's called community rating. Because when you have health insurance and it's 2 to 100 employees, it's called community rating, meaning it's a flat rate single, flat rate family, regardless of age, regardless of industry and things like that. So claims don't matter, things like that don't come into play. When the PEOs first started coming out, they were saving tremendous amounts of money. But what we've seen over the last couple of years last year or two especially, is the difference in the premium between a PEO and a traditional community rated plan. Is we've seen the difference is shrinking. And one of the disadvantages of a PEO is that you do have to pay a lot of administrative charges for them to process all your paperwork and do all the stuff and do everything. So we've seen it kind of a mix. So we do work with PEOs, but it takes a certain fit and certain size company, and a lot of details go into it as to whether a PEO would make sense for you as an employer, because the savings aren't there, and a lot of the PEOs, especially lately, have been taking substantial rate increases, so they're starting to fall out of favor a little bit. All right, so we're going to do the first. Oh, I'm sorry. Yeah, the next slide. Sorry. Okay. Actually, yeah. Okay. So we're going to. Sorry, apologize for this. I thought we were going to do the polling question first, but okay. The traditional. So what we've had a shift in is over the last couple of years, especially the last 3 or 4 years, especially, is companies going away from traditional plans going into high deductible plans. And what a high deductible, okay, oh, there it is. There's the polling question. So, okay. So the most important things with a high deductible plan is what's called the MOOP, which we just asked the question as to what a MOOP is. So a MOOP is the maximum out of pocket that you can pay for claims. So you go to a hospital, you go to a doctor, and what's happened with the traditional plans, you pay a copay and you have a deductible that you have to pay. And some of the plans have what's called co-insurance, which is basically additional money out of pocket. Well, when the ACA came into effect, all the plans now have what's called a maximum out of pocket, which is that MOOP terminology. And that's the most you could ever pay, no matter what you have in claims. So whether you have $30,000 in claims or $50,000 in claims or $500,000 in claims, doesn't really matter, because once you hit your max amount of pocket, you are done. So that's what a MOOP is. Next slide. Yeah, okay, that kind of explains what a MOOP is, so we can skip that slide. So now with a high deductible plan, the deductible is money that you're going to pay out of pocket. You heard the term deductible. Well, that's different than a copay. A copay is, your $20 or $30 that you pay at a doctor. A deductible applies when you go to have surgery or hospitalizations or things like that, and the deductible applies to those things. And typically a deductible is $1,000 or $2,000 or things like that. Well, when you go to a high deductible plan, and we can go to the numbers. So once you paid your deductible, then you're going to pay your co-insurance and things like that. Why don't we go to the next slide? Okay, so there are 4 levels of plans out there. There is gold, platinum, gold, silver, and bronze. And all of the plans are virtually the same. So whether you have a platinum plan with Oxford or a platinum plan with Aetna or a platinum plan with Emblem, they're basically the same type of plans. The differences between the platinum, the silver, the gold, and the bronze is simply, what are you paying in deductibles, what are you paying in co-insurance, and what are you paying out of pocket, and subject to that MOOP number. With the platinum plan, you're going to pay very little copays, usually $10 or $20, and you're going to pay very little maximum out of pocket. However, what you're going to pay, though, with a platinum plan is a much substantially higher premium. And then if you go from a platinum plan to a gold plan, now you're increasing your copays a little bit, you're increasing your deductible a little bit, and you're increasing your max out of pocket. And then a silver plan is the same thing. The silver plan is a 40 and 70 type of copay, but with a $2,500 deductible as opposed to $1,000. But what's happened is the last 2 or 3 years, the maximum out of pockets on the traditional copay plans have gone up and up and up to the point where with a silver plan, even though it's more expensive premium wise, you're also going to pay more out of pocket if you have claims. So next slide. Okay, so let's talk about the numbers and how this can really save you money, because that's really what we're here to talk to you about, is how we're going to save you, your company, your employees money and things like that. So with a gold plan, the average price on a gold plan is about $2,500 per month per family. Well, by staying with that same carrier, and we emphasize that we try to keep people with the same doctors, with the same carriers, so that there's a very smooth transition if you're changing to these plans, because it's difficult enough to change plans, but to change carriers and change plans becomes even more difficult. So if you go from a gold plan to a bronze plan, the bronze plan, you're going to pay $1,500. So the company is going to save $1,000, I'm sorry, $12,000, $1,000 per month per family. And you can see on the slides, it talks about that MOOP number. Well, the gold plan has a maximum out of pocket of $10,400, meaning if you're a family, the most you could ever pay out of your pocket is $10,400. And with a bronze plan, the most you could pay out of your pocket is $13,500. But you can see the company is saving $12,000 in premium. So the way we set it up, if we go to the next slide, there you go. Okay, so the way we recommend you set it up, this way employers win, but employees win as well. So the way we recommend you do this is you set up a flexible spending account, which we had talked about previously, and the employees pay the first $500 of claims. Now you can see where it says $500 of contracted rate charges. That's the most important thing with high deductible plans, because what counts towards claims with a high deductible plan is not what the hospital or doctor charges, it's what the insurance company allows. And that's what's called the contracted rate. So if you look at any of your explanation of benefits, at the top of your explanation of benefits, it'll say the doctor charged $3,000. And then at the bottom, it says contracted rate $400. And then it says your responsibility is $0 if you have a copay plan. Well, with a high deductible plan, you're going to be responsible to pay that contracted rate. But in most cases, that contracted rate is substantially less than what the hospital and doctor charges. For example, I had a client who had a $25,000 bill from NYU. The bill he got was $2,800. Of that $2,800, he only paid the first $500. So now, how do companies win and how do employees win under this scenario? Well, if the company is saving $12,000, which is the average savings, and they're funding $7,000 on that health reimbursement arrangement that we talked about earlier, the company is guaranteed, worst case scenario, to save $5,000 a family and $2,500 a single, because the numbers work proportionally the same way with the singles. So the company is going to save $5,000. What we're seeing over the last 6 months because of coronavirus, companies are saving a lot closer to their best case scenario than they are their worst case scenario. Because between employees paying the first $500 and people not having a lot of claims, the company is paying very little out in claims. We had one client that we moved in April. We saved him $7,500 a month in premium. It was a 20-person firm. The first 3 months, he saved $22,500. He paid $3,000 out in claims in the 3-month period of time. So he's saving almost all of his best case scenario. Now, that's not obviously going to continue forever, but with the advent of telemedicine and with who knows how long this situation is going to be with Corona, we feel that certainly over the next year, now is a good time to consider looking at high deductible plans. And one other thing that's allowed is the insurance companies are allowing people to change their plans off anniversary. So that's been a change since Corona. Some of the carriers have kind of backed off on it, but there are a number of carriers that will allow you to keep your same carrier and change your plan off anniversary. And there are solutions for that as well. So if we go to the next page, it'll kind of give you an example, because most people think, and when the high deductible plans first came out, you would save $5,000, but you could have $10,000 worth of claims. And most people thought, oh, well, high deductible plan is good for an employee who never goes to the doctor. So I'm going to give you 3 examples here, real life examples of how not only does the company win, but the employee wins. Example number 1 is somebody who has major illnesses. So they have $50,000, $60,000 of claim. Well, under the gold plan, they're going to pay $10,400, as we had gone over before. Under the bronze plan, they're going to pay $13,500. But with the company funding $7,000 of the deductible, as crazy as it sounds, the sicker an employee gets, the more the employee saves. Because an employee, if he maxes out with a high deductible plan, will spend $4,000 less out of their pocket. So you can see that the misconception of, hey, it's going to cost me way more money if I get sick, it will actually cost you way less money. If we go to the next page. Okay, so again, kind of a middle of the road example. Somebody has surgery. Well, with the gold plan, they're going to pay $1,000 hospital copay. They're going to pay $60 copay for doctor visits. So 4 visits, $240. So it costs them $1,240. And the most important part of it is that's with after-tax dollars. Again, remember with the flexible spending account, it's pre-tax dollars. So now under the bronze plan, the employee, instead of spending $1,240 out of pocket, is now going to spend $500 out of pocket, and then they're done. Because the $7,000 the company is willing to provide for the employee is going to be more than enough to cover their claims. Because we saw at the first example that the worst case scenario, they still saved money. But under this scenario, they're still going to save money, because even though they're laying out less because they have less claims, but they're still laying out less out of their pocket because they're only paying this $500 and it's pre-tax dollars versus $1,240 with after-tax dollars. Next slide. And this is for somebody who's pretty healthy. So you have somebody who goes for a couple of doctor visits and a couple of prescriptions. Well, prescriptions for most plans are $15 for primary care doctor, $35 for name brand. So you're paying about $50 a month. So you're going to pay about $600 a year for those claims. And then a couple of doctor visits at $50 or $60 a doctor visit. So they're going to pay $750 out of their pocket. But again, that's with after-tax dollars versus the bronze plan where they're going to pay $500 pre-tax. So when you look at it, summarizing all of this stuff is that as an employee, you're going to save a couple of $100 to $4,000. And as an employer, your worst case scenario, you're going to save $5,000. Your best case scenario, you're going to save $12,000. So if you have no claims, and so no matter what happens, no matter where you have claims, no matter what the claims are, and again, this is not self-funding where, a big claim can kill you and things like that. all of these plans are covered by insurance companies. So they all have that maximum out of pocket. So you get 1 or 2 sick people that have a lot of claims. It's not going to cost the company any more money. It's not going to cost the employee any more money. And everybody wins, because employees, again, save a couple $100 to $4,000, and companies save anywhere between $5,000 and $12,000. So it's a win-win all the way around. And you might ask, well, then why doesn't everybody have high deductible plans? It's simply a matter of education. What we do at HKM Associates, a little bit different than most other brokers. We customize benefits around the doctors. We run employee meetings for all our groups. Every employee gets our cell phone number, so we service at a much different level. And a lot of brokers don't show high deductible plans. I hate to say it, and it's kind of a knock on the industry. It's more work, it's lower commissions, so brokers don't want to take the time to educate. They tell you renew as is, and I don't want to harp on that much. But that's really it. I tried to keep it pretty brief. And to reach me, my website is www.hkmassociates.com. And my cell phone number, which is always the best number to reach me at, is 516-316-1255. I appreciate the time. I wanted to keep it brief and not bore you too much. So thank you very much for all your time.
Jeff, you did a great job. It's a very important subject, and it's a very sore subject to a lot of employers and employees. Some of the things you hit on, I know I have experienced firsthand, getting those statements back and seeing what I have to pay for that. So actually, there's a question that came in on the chat line. It says, what is the legalities of offering different plans to different people?
Okay, so you are still allowed to discriminate within a class. So if you have officers and other employees, you can do a different type of plan for different type of people. And even within the high deductible structure, you are allowed to fund different amounts for different people. The other thing that I forgot to mention is, with the HRA in combination with the flexible spending account, okay, you can not only decide how much of the deductible you want to cover, you can decide which portion of the deductible you want to cover. So we have clients who cover 50% of all claims up to $10,000. We have clients who say, let the employees pay the first 500 or 1,000, and then we'll kick in. You can do it on the front end, the back end. Combining the flexible spending account with the health reimbursement arrangement account allows you to mix and match and do all of those kinds of things. But yes, you are still allowed to discriminate by class and have a high plan for executives and a low plan for all others.
Okay. So I just put my contact information in the chat box. If anyone has additional questions that you may think of after this, feel free to email me, or you email obviously Jeff directly, and we'll get them all answered for you.
Now, my email address is jeff@hkmassociates.com.
That's easy to remember. Anyway, I want to thank all the participants for attending. I want to thank Andy, obviously, for facilitating this sharing screen, and Jeff, of course, thank you for your expertise and everything, and we look to have you back again.
Sounds good. Thank you.
Well, thank you, everyone. Have a great and safe afternoon.